Hello friends, today I want to share one of my simplest approach to understand knee biomechanics, and I'm Dr. Subhash Khatri. Let's understand the overview about the knee joint. Knee joint is one of the largest joint in human body. It connects the thigh to the leg. It is one of the complex joint. It offers locking and unlocking movements. It also offers shock absorption. Probably knee is one of the commonly affected joint with various disorders due to old age as well as obesity. Let's understand the functions of knee. Knee allows you to bend and straighten. In other words, we call it as flexion and extension. Knee also allows you weight bearing. It permits you walking movements. It allows you jogging. It also allows you running. It permits you jumping. And it helps to absorb the shocks. So in short, we can say that it permits varieties of activities of daily living such as ambulation, bathing, cleaning, dressing, eating, transfer and toileting. We need normal function of knee joints for athletic activities, and it is also possible that sometimes knee pain comes because of overuse. So let's try to understand normal and abnormal biomechanics. The abnormal biomechanics, we can also call it as a pathological biomechanics or there is pathomechanics. So let's try to recall the normal biomechanics, and for the sake of understanding, I have created a simple mnemonic or memory trick such as OMAN, where O stands for osteology, M stands for myology, A stands for arthrology, and N stands for neurology. Further, we continue K2CM, where first K is for kinematics, second K is for kinetics, C for circulation, and M for movements. So from osteology point of view, there are three bones that takes part in formation of the knee joint. That is femur, tibia, and patella. So it's an articulation between the lower end of the femur, upper end of the tibia, and from the front side, the patella, which is one of the largest sesamoid bone, covers the knee joint. I'm sure you can see that this is lower end of the femur, this is upper end of the tibia, and this is patella. Now you can also see that there's a head of the fibula here, but it directly do not participate in formation of the knee joint. At the knee, static stability is also offered by various ligaments, and the key ligaments are anterior cruciate ligament, posterior cruciate ligament, medial collateral ligament, lateral collateral ligament, and meniscofemoral and other supporting ligaments. Now, basically, anterior cruciate ligament prevents anterior tibial translation. Posterior cruciate ligament prevents posterior tibial translation, and medial collateral ligament resists valgus stress. In addition to that, lateral collateral ligament resists varus stress. So for myology, let's understand the muscles around the knee joint. We have the muscles that can perform bending action that we call it as a flexion. And the muscles which performs the knee flexion, let's call them knee flexors. They're basically biceps femoris, semimembranosus, semitendinosus, sartorius, gracilis, and popliteus. Now the muscles that perform straightening activity that we call it as the extension, and the knee extensors are rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. From arthrology point of view, knee joint is one of the synovial and modified hinge joint. Now, kinematics, the study of movements or motion as a branch of biomechanics, is called kinematics. Now, from kinematics point of view, let's first talk about osteokinematic. And in osteokinematic, we got knee flexion range of 130 to 150 degrees, and knee extension is considered 0, or we call it as a full or 180 degree, or sometimes it can be up to 5 degrees. From orthokinematic point of view, at the knee joint, we also get orthokinematic movements in form of rolling, slide, and spin. Let's call it as RSS, where R stands for rolling, S for slide, and S for spin. Now let's talk about kinetics. Basically, kinetics is a study of forces. Now, various forces acting at the knee joint are muscle forces, ligamentous forces, meniscal forces, ground reaction forces, joint reaction forces, patellofemoral forces, shear and compression forces. Now, in-depth study about the abnormal biomechanics or pathomechanics that I'll teach you in another lecture, and that we can memorize, or I'll give the memory trick for remembering pathomechanics in form of PTD, where P stands for paralysis, T stands for trauma, and D stands for deformity. I think we can stop here about the normal knee biomechanics. In case you have any questions, queries, please feel free to reach me. Thank you.